Good evening, ladies and gentlemen. This is Phil Schauer, and welcome to what's going to be an incredible and moving tribute to our friend, Harvey Sugerman. Tonight, helping me moderate are my very good friends and colleagues, Eric De Maria and Carl Byrne. This is really incredible. I do want to recognize the ASMBS for supporting this event tonight, providing lots of resources, including personnel, technical resources, especially James Osterhout, who behind the scenes has put in an incredible amount of work. I want to thank the organizing committee, who are just a group of friends of Harvey. Let me just give you a sneak peek at the program. If you go to the chat session, you can get access to the agenda for tonight's program, and you can follow along if you like. The program is segmented into various elements. The first section, which Carl will announce in a few minutes, is going to focus on Harvey's professional accomplishments in his career. I think you're going to find that very interesting, extraordinary. Followed by that, you're going to hear from some of Harvey's esteemed colleagues, some luminaries in the field, and commenting on very special attributes of Harvey in a very personal way. Following that, we're very fortunate to have received an enormous number of videos from all over the world from people who wanted to pay tribute to Harvey. So you're going to see those as well. Following that, we have a brief video tribute on behalf of Harvey's family. And as appropriate, we're going to let Harvey give the last few words. So you're going to hear from him at the very end. Now, the program that we put together is mostly pre-recorded video that have been put together in a very elegant way. The moderators, Eric and Carl and I, will be coming again live to introduce some of these segments. But most of the program tonight is just this incredible pre-recorded material. The entire program is going to be recorded for posterity, and ASMBS will announce exactly how to access the content. Now, due to the limitations of this Zoom platform, we are unable to allow audience members comment either through video or audio. However, we encourage you to make comments on the chat. And whether it's a personal comment, an attribute of Harvey, a very brief sort of story, feel free to do that, comment as we go along, and all of those texts will be preserved as well. Also on the chat line, look for links, link to the agenda and some other information about Harvey that may be of interest to you. So we are delighted that you all have decided to spend your time tonight. It's going to be approximately a couple hours. We're all going to sit back, relax, and we're going to witness an extraordinary life. Now, at this time, I want to send it over to my good friend and colleague, Eric De Maria, who's put a lot of effort into this as well. So Eric, take it away.
So tonight is an incredibly special evening, I think, for many of us. You know, I think that many of us had a special relationship with Harvey Sugerman. And, you know, letting his passing pass without notification and celebration of his life would simply have been wrong, even in these difficult times. So what we want to do this evening, I think, is to pay tribute and to recognize his contributions, as well as the full three dimensions of the man both the colleague and the teacher and the surgeon and the researcher, but also the family man and the special person that Harvey was. So what we also thought going into this was that there were many of us who would wish to see him recognized in an enduring way, perhaps with an award or a special recognition in his name. And because of that realization, we thought we would connect with the ASMBS Foundation and seek out a way for those of you who are so motivated to donate towards that objective. Now, we don't have a final plan in mind as yet, other than knowing that we wish to name something after Harvey for perpetuity. But we do have a donation mechanism in place if you're so inclined to support that dream, that objective. And we're going to put that up on the chat so that you can find the link to donate if it moves you to so donate. It is a tax-deductible donation, and it will be earmarked to a special tribute for Dr. Harvey Sugerman. So please keep that in mind as we go through tonight's program. And then Carl Byrne is going to introduce our first section.
Well, thanks, Eric, and thanks, Phil. And it's absolutely an honor to be here tonight. Many of you probably don't realize or recognize that not alone was Harvey a consummate bariatric surgeon, but he had very varied interests in the field of surgery. There are many of you out there who are young surgeons who don't realize that Harvey had an incredible basic science research lab back in the day and was interested in acute lung injury. In fact, when he came to MCV first, he came as an acute care and trauma surgeon, critical care surgeon. And his interest was in acute lung injury, or as we called it back then, ARDS. So the next series of speakers are going to speak to Harvey's very varied interests in surgery. The first person that's going to come up on video is Bob Brolin. And Bob and Harvey go back, way back to the mid-'80s. And they remained friends right up till Harvey's death. And Pam Brolin and Betsy have been friends for years and years too, and it was a pleasure to actually hang out with those folks at the ASMBS and various other meetings over the years and listen to all the stories. And Bob will talk about the early days of bariatric surgery and some of the publications that he and Harvey put into the literature together. The next person up will be Bruce Wolfe, the consummate academician, who has gone through, and thank you very much for doing this, Bruce, has gone through the myriad of Harvey's publications in all sorts of various different disciplines, and has culled out some to particularly emphasize. Third person up will be Raoul Rosenthal, who everybody knows. As everybody here knows, that Harvey basically founded the journal Sword back in the day, and Raoul will talk to the evolution of that and what it has become. And it has actually become one of the most popular journals for obesity surgery throughout the world. Eric Di Maria joined the faculty at MCV when I was a resident there. I was probably a few years actually older than he was when he came on as a faculty member, and I can't even begin to tell you the fun we all had when I was a chief resident and Eric had joined the faculty. He will talk about Harvey's practice of bariatric surgery and the rest of his surgical interests at MCV as a faculty member. I am going to talk about Harvey's research lab, and this was incredibly prolific. And later on in the program, you will hear from some of his overseas fellows. I was his first bona fide research fellow. He'd had some medical students working in the lab, but I was his first research fellow, and I will talk to that. And then lastly, Harvey's interest in acute care and trauma will be addressed by Grace Rosicki, who I'm sure everybody knows. So without further ado, we'll move on to Bob Brolin's tape.
Hi, I'm Matt Hutter, the president of the ASMBS. When Harvey Sugerman passed away, there was a tremendous outpouring of love and respect for all that he's accomplished over his life. On behalf of the ASMBS and all its members, I would like to take this opportunity to thank Drs. Phil Schauer, Carl Byrne, Eric DeMaria, and the entire organizing committee for putting together this tribute to celebrate the life of Harvey Sugerman. I would also like to thank all of you who contributed your thoughts and reflections and stories about this icon of bariatric surgery. Harvey was one of a kind, and we're all better for having known him.
It is truly an honor to lead off the video commemoration of the persona and career of my good friend Harvey Sugerman. I first met Harvey at the Cedar Rapids Airport following the 5th Annual Bariatric Surgery Colloquium in 1981. From the beginning, we had similar perspectives on the evolving subspecialty of bariatric surgery. During the ensuing 4 decades, we became good friends. In keeping with my assignment of reporting only his early years, I'm going to describe his involvement in several important events of that era. Perhaps the most important was his first nomination for the presidency of the Society in 1990. He was the only nominee on the slate submitted by the Executive Council to the membership. However, he was challenged by a floor nomination motivated, in my opinion, primarily by selfish intentions. He lost in an extremely close vote. However, the effects of this election pervaded the society for the next 2 decades. During the next several weeks, all but 2 of the academic surgeon members, including me, resigned from the society for at least 1 year. I think Harvey was a non-member for 3 years before his return. Harvey never shied away from controversy, even in the early years. He challenged Ed Mason on his home turf on the merits of vertical banded gastroplasty. Noting that his voice was a distant echo in the cornfield, he performed the first prospective randomized comparison of vertical banded gastroplasty with Roux-en-Y gastric bypass. This study clearly demonstrated the superior weight loss with gastric bypass beginning at 6 months postoperatively. His position on the lap band was almost an obsession. He attended the FDA meeting in which the early release of the lap band was discussed. His commentary delayed release of the band for 1 year. Although it is not my charge to enumerate or elaborate his multiple contributions to bariatric surgery over his lengthy career, there are 2 notable personal traits that characterize his professional conduct. The first is honesty. Although his published results were always very good to excellent, they were rarely the best. But in my opinion, they were always honest. I never doubted his credibility. The second is courage. Although he was occasionally criticized as outspoken and opinionated, he stood his ground on the evidence and did not refrain from reporting negative results. Perhaps the most important example of this was his experience with a malabsorptive modification of failed Roux-en-Y gastric bypass. In that report, he recognized that a 50-centimeter common channel in conjunction with a long biliopancreatic limb resulted in dangerous malnutrition and a high mortality. This information likely saved hundreds of lives. Harvey and I probably became closer after his tragic injury. We spoke weekly in conversations dominated by politics, family, and the Pittsburgh Steelers rather than bariatric surgery. He was a remarkable man, worthy of the highest respect.
Good evening. I'm Bruce Wolf, longtime colleague, mentee, and friend of Dr. Harvey Sugerman. it's my honor to participate in this tribute to Dr. Sugerman. My charge is to discuss the Sugerman publications, which is a daunting task given that there were approximately 330 such publications. The categories of topics which Dr. Sugerman published upon, it demonstrates the wide range of interests and competence of Harvey. These include multiple papers on bariatric surgery itself, establishment of multiple comorbidities of obesity, a subject that was not well understood or recognized 25 to 30 years ago when Harvey began these studies in publications. He was able to demonstrate that the comorbidities were indeed comorbidities by demonstrating response to weight loss. He also published a number of papers in general surgery, most often gastrointestinal surgery. Finally, he published on education, fellowship, and related educational activities. The key to getting out the word and establishing the credibility and appropriateness of bariatric surgery was publication in a wide array of journals, reaching as many medical and lay people as possible. These include Obesity Surgery and SWORD, from which we'll hear from Dr. Rosenthal. He also published in the premier general surgical journals, the Annals of Surgery and then Archives of Surgery. In the general medical arena, he published in the two most prominent medical journals in the world, the New England Journal of Medicine and the Journal of the American Medical Association. Finally, he published in multiple medical and surgical specialty journals, such as journals of nutrition, gastroenterology, critical care, and trauma, and others. In bariatric surgery, he published randomized clinical trials at a time when such trials were rarely done in surgery in general. These included comparisons of vertical banded gastroplasty to gastric bypass to adjustable gastric banding, both of these which were game changers, period. He also published on the risk, complications, and their management, as well as revisions of bariatric surgery. He published on the role of surgery in adolescents and analyzed the cost benefits of bariatric surgery. In general surgery, he demonstrated that he was indeed a master surgeon in the operating room, publishing on techniques of gastrointestinal anastomosis and related techniques. He published several papers on incisional hernia, which, as we all know, was a major problem following open bariatric surgical procedures. He was, with Dr. Di Maria, one of the leaders in the development of the laparoscopic methodology for the performance of these operations. We'll hear more about his interest, research, and publications in critical care and trauma. There are many of these which made major contributions, particularly in the pulmonary complications of severe injury and infection. Let's look at some specific examples of the Sugerman publications. This first one is a randomized prospective trial of gastric bypass versus vertical banded gastroplasty, including inclusion of some mechanistic research regarding why it is that gastric bypass is superior to vertical banded gastroplasty, despite the gastric pouch being of nearly identical size. Vertical banded gastroplasty was the predominant operation at the time. This was a game changer, leading to increased use of gastric bypass. This is a study regarding consecutive outcomes from the use of laparoscopic Roux-en-Y gastric bypass. The term consecutive is crucial because that means no case has been deleted from the series, thereby hiding a poor outcome. And again, Drs. DeMaria and Sugerman were instrumental in the transition to the laparoscopic approach. One of Harvey's favorite topics was the intra-abdominal hypertension as caused by severe obesity. He measured abdominal diameter and related abdominal hypertension to multiple comorbidities, which had not previously been done. One of those was the effect of abdominal hypertension on venous flow. In this case, the effect of hypertension on renal vein flow and renal function. He demonstrated an improvement in both renal function and venous flow by bariatric surgery-induced weight loss. This is one of Harvey's publications in the Journal of the American Medical Association, publishing on a wide interest to the general population and medical community on deep venous thrombosis, pulmonary embolism, which in a variety of settings were increased by abdominal hypertension, in this case, air travel. Harvey was never one to hold back if he had criticism or disagreed with any of his colleagues or publications. In this case, he published a letter to the editor of the New England Journal of Medicine following publication of a paper which was favorable to the Gomez gastroplasty, a procedure in which a partial stapling of the stomach was done with no reinforcement of the stoma. Harvey was quick to point out that this was a failed operation, despite its appearance in the New England Journal. One of Harvey's major contributions in establishing bariatric surgery as a mainstream intervention for the treatment of obesity was his participation in the construct of multiple multidisciplinary guidelines for the treatment of obesity. In this case, the guideline was the medical management of patients who have undergone bariatric surgery. There were others focusing on the importance of weight loss induced by bariatric surgery in a variety of clinical settings and comorbidities. In summary, Dr. Sugerman's research and associated publications was instrumental in the establishment of severe obesity and as a disease, its related comorbidities, and the value and safety of performing bariatric surgery to accomplish otherwise unattainable weight loss in response to the comorbidities. Thank you very much.
Good evening. Dear Betsy, dear Sugerman family, dear friends, dear colleagues from around the world, I'd like tonight to say some words on behalf of the editorial board of SWORD and also on behalf of the managing editors of SWORD, Luke Verillo, David Newcomb, and Nancy Nicholas. Harvey Sugerman, MD, was a mastermind, a master surgeon, an academician par excellence. He single-handedly put together SWORD, this phenomenal journal that ranks number 26 among over 200 surgical journals worldwide. Harvey was also a great researcher. We shared the passion of intra-abdominal intracranial pressure, and he tried to fight eclampsia. He felt that this was a venous disease and had put together a phenomenal device that he was, until 2 weeks before his passing, trying to put through the FDA. Harvey always put his patients first. And I'm sure that thousands of those would love tonight to say some words because, as Eric de Maria well said, they adored Harvey. When I broke the news to the editorial board of Sword, I received, I would say, 36 of the most passionate and sometimes funny stories related to Harvey. Probably one of the most interesting ones was the one of Wei J. Lee from Taiwan, who said to me short after I broke the sad news of Harvey's passing, said, "Raul, the passing of Harvey is sad news, but Harvey finished his duty on earth beautifully." How true these words were from someone that we know was a devoted father, grandfather, husband, a man of love, honesty, integrity that gave meaning to his life, not with power nor pleasure, but by showing integrity when fighting adversity near his beloved wife, Betsy. Something we learned from this unforgettable Ed Mason lecture he shared with us. It's interesting that 2 weeks before Harvey's passing, I visited with him. And together with my wife, Seema, we had a great time. We talked about life, love, family, research, obviously about the journal. Remember bringing him some cookies. And Seema wanted to bring him some healthy food. So Harvey said, "No, I love sweets. I'm Sugerman." I think how privileged I was to have seen and spent some time with Harvey 2 weeks before his passing, and having had the last glimpse of a true surgeon, a master, a giant in the world of surgery. To me, obviously, a friend and a mentor. How ironic life can be that what took Harvey's life was a life-threatening injury he sustained while trying to hang a house for a bird. Amongst many other passions Harvey had, he liked to drink 18-year-old scotch. He loved fly fishing. Obviously, he loved surgery, academia, and his family. As well said by Henry Buchwald, we will miss him, but we will quote him constantly. We will never forget him. So on behalf of SWORD editorial board members, thousands of friends, colleagues, surgeons, patients, and on myself, I'd like to say goodbye to a friend. We will miss you. Thank you very much.
Hello, my name is Eric DeMaria, and I've been asked to talk about Dr. Harvey Sugarman's life as a surgeon and his time at Virginia Commonwealth University. Dr. Sugarman joined the faculty at VCU, and early on he expressed interest in the emerging area of surgery to treat obesity. His new chair, Dr. Laser Greenfield, told him to study bariatric surgery if he wanted to do it, and make sure that he studied whatever he wanted to do. So in the 1980s began the open gastric bypass and vertical banded gastroplasty surgery at VCU. This led to randomized controlled trials of VBG versus gastric bypass, and the discovery of the superiority of gastric bypass in patients who were addicted to sweets eating. And this subsequently led to the Sugarman sweets eating hypothesis. There's no more fitting area, obviously, for Dr. Sugarman to have made his early mark in our field than in the study of sweets eating behavior. And this leads me to recall something that I heard him say jokingly on several occasions. After all, I am a sugar man. Those are his words, not mine, but do provide some insight into his sense of humor and his humility. For years, Dr. Sugerman taught his residents to perform open gastric bypass. He was particularly proud that third-year residents in the VCU program would often perform 25 to 35 open bypasses, and they learned a lot about GI surgery and creation of anastomoses during his rotation. Dr. Sugerman ran a teaching conference each week in which complex GI surgical cases were discussed. He always insisted on up-to-date literature being presented each week with an emphasis on comparison studies, including some sort of control group, preferably in a randomized trial. We heard him talk about the need for randomized control data often. Ultimately, the entire world would hear how important this was in our field, and as he became more and more well-known and became a world-renowned leader in our growing specialty. As a surgeon, Harvey was a capable and never-tiring technician in the OR. He was very busy with surgical cases, and patients sought him out for his expertise from near and far. The old adage, never let the skin stand between you and the treatment, was fitting for Harvey's view of surgery. He would often tackle difficult cases that no one else was willing to perform. I recall the case in which he performed a simultaneous gastric bypass and a total colectomy with ilioanal anastomosis. I also recall the patient who had had a previous Whipple in which Harvey performed a gastric bypass. There were some complex and difficult combined cases in which two procedures were ultimately done but not planned. I remember one case in which the patient had multiple previous operations and the gastric bypass took many hours. Finally, when the procedure was winding up, Harvey discovered the abdomen could not be closed due to the colon distension and edema of the GI organs. He frequently decompressed hollow viscous organs distended with gas by deflating them with inserting a needle on suction, then sewing up the small hole that was left. In this case, however, that did not work, so Harvey promptly proceeded to remove most of the colon to allow the abdomen to be closed. Difficult problem, creative solution, to say the least. At this point, I have to pass on the nickname given to Dr. Sugerman's hands by the VCU residents. Yes, I said his hands. The nickname was Sugar Paws, or rather his hands were named the Sugar Paws. Upon opening the abdomen of a morbidly obese patient, sometimes the omentum, as we all know, would be stuck down out of sight deep in the pelvis. This is when the sugar paws would disappear into the pelvis, and a few moments later, the omentum would be freed up and the case could proceed. Privately, the residents would describe this as the sugar paws maneuver. They would sometimes say this when scrubbed with me, that they were going to use the sugar paws technique for something. This also referred to encircling the esophagus with a Penrose drain during the first steps of an open bypass. Dr. Sugerman's hands seemed able to do this magically and almost instantaneously using those sugar paws. The photo behind me is one of Harvey in the OR doing a lap gastric bypass as the surgeon. One of the most impressive things about him in the OR to me is that he learned to do this operation laparoscopically in his last few years of clinical practice. I want to point out, however, that he did not come to the decision to do lap bypass easily. He had to be convinced it would be better for his patients. When Michael Schweitzer and I started doing the operation via laparoscopy in 1997 and sending patients home on post-op day 2, Harvey decided to start sending his open bypasses home on post-op day 2, just so we knew that there was not a length of stay advantage. But ultimately, Harvey was about the data, and he was impressed with the lower wound infection and hernia rates, and he decided to learn how to do the operation. Harvey was not going to stand aside and let other surgeons provide a superior treatment to his patients. In this photo, he is likely standing on multiple steps in this case, as he was not a man of tall stature. However, I can assure you that he had the respect of absolutely everyone in that OR. I don't know if you can tell, but he often worked in front of a group of observers. Sugerman's surgeons came to VCU from all over to learn about bariatric surgery from Harvey. It was an impressive parade of people coming through week after week. And Harvey gave willingly of his time to help them learn the specialty that he had helped pioneer and love. When Phil Shower began doing his courses in laparoscopic gastric bypass at University of Pittsburgh, Harvey suggested that I go and also that I volunteer to help with the course by speaking about our early lap bypass experiences. As I got to know Phil, one thing became quite clear to me. Although I represented VCU at those conferences, I wasn't the one Phil wanted to be there. He wanted Harvey Sugerman. I know Phil kept after Harvey until one time Harvey agreed to come up and teach in the UPMC course. Phil was doing live surgery to teach the room full of surgeons, and Harvey was watching. I'm not sure that Phil really knew what he was getting into by having Harvey there, but I remember very clearly when Phil began to close the Peter-Sen defect, Harvey would always say Peter-Sen with 3 E's and no O. And Harvey asked for the microphone and began teaching Phil how to close the defect correctly. Phil kept picking up some mesentery and Harvey said, no, not that tissue, over to the left. That was classic Harvey. He wanted things done right and wasn't concerned about anything except making certain that patients were cared for in the right way. We all learned a lot about Peterson's defect that day at UPMC. I am forever grateful to have worked closely with Dr. Sugerman, that I was able to see him up close and in action nearly every day during those years, and for his kindness and his support for me as I began my own career. One of the greatest compliments I have ever been paid was that Harvey apparently trusted me as a surgeon, as I was nearly always the one he asked to cover for his patients. He was very protective of his patients and wanted nothing but the best for them. They in turn adored him, as they should have. Years later, I became the chief of that division after Harvey was forced by health issues to retire too young, one of several unfair twists in life for him, as he should have enjoyed more years practicing the craft that he loved and had mastered. Yet we collectively benefited from this twist as it led to his single-minded focus on the pursuit of tremendous success for Sword. Harvey was a leader in every sense of the word, tough but kind, goal-oriented and dedicated, an adventurous and inquisitive spirit, a dedicated academician, and yes, also a bit of a curmudgeon at times. Several of you have perhaps felt the sting of being fired from Sword's editorial board for not delivering on reviews in a timely manner, a sting I felt on occasion. But Harvey was so good, so dedicated and committed to excellence that his leadership always made me want to try harder and do better. Yet he never expected anything from all of us that he didn't already expect of and adhere to himself. I watched him crusade tirelessly for every cause that he thought was right, no matter the odds against him. With Harvey's passing, our field has indeed lost one of our icons, a man who refused to break even when life dealt him challenges that would break anyone. He will be missed greatly and by many. I hope we will find an appropriate way to honor his memory, as we have indeed lost one of our pioneers and a wonderful man who provided us all with his guiding light.
Hello, my name is Carl Byrne. I'm a surgeon at the Medical University of South Carolina, and I'm the director of the Bariatric Surgery program there. And I've been asked to talk about Harvey's early research interests, which, despite what many people perceive him to be, he was interested in septic shock and acute lung injury, and actually had a lab at MCV where he studied this. He had a grant from the Department of Defense, which I think he obtained while he was in the Army, or certainly his interest in septic shock and acute lung injury, as we called it then, ARDS, occurred when he was in the Army. The entire project and process was overseen by Dr. Basil Pruitt, who many people will remember as a giant in the field of burns and shock. So when I arrived in New Year's Eve of 1987 as Harvey's first research fellow from Ireland, the projects that Harvey had started about a year earlier were well underway. The premise of his research was that if you rendered large animals septic and inflammatory mediators were produced during this septic phenomenon, then by administering all sorts of anti-inflammatory substances such as methylprednisolone, ibuprofen, diphenhydramine, cimetidine, and so on and so forth, you could alter the course of sepsis. So what we would do is we would instrument the animals, and we had a system of scintigraphy where we would look at extravascular lung water, render the animals septic, then administer all these various different medications to see if changes could be brought about. The entire lab was run by a phenomenal person called Chuck Blocker, who worked with Harvey for years and years and years. And Chuck, while we were all there as fellows in Harvey's lab, Chuck became our best friend and guided us through all the ins and outs of how to do the research properly. Harvey was pretty hands-on. He would design the projects, but essentially he would allow us up to our own devices. I found it particularly hard when I arrived first, having spent several clinical years and had not had much research exposure, certainly to basic sciences. So in trying to get my projects going, I liaised with a pulmonologist and critical care doctor who was a couple of floors down from our lab, named Barry Fowler. Barry appreciated the work that Harvey was doing, but because we were using scintigraphy, which is radioactive substances, Barry didn't want to have anything to do with coming up to the lab where these animals were receiving radioactive material. So although he thought we were doing great work, he didn't want to participate in it too much. After I had been in the lab for about a year, a second Irish fellow, Declan Carey, came out to join us, and Declan and I persuaded Harvey to collaborate with Barry Fowler's lab. And Barry had all sorts of expertise where he would be able to do bronchoalveolar lavage on the animals, and we could harvest peritoneal macrophages and study the function of peritoneal macrophages in sepsis, and how the administration of these various medications changed the production of various substances like TNF and prostaglandins and so on and so forth. So that's basically was the focus of our research, and it became incredibly fruitful over the course of probably about 8 or 10 years. Declan carried on after me, and then another fellow came out, Paddy Mullen, who has unfortunately passed away since. Paddy came out from Dublin as well, and then Kieran Walsh came out from Dublin. So we had a series of Irish and English fellows. Al Windsor came out from London, and Ajit Srinivardena, who came from Manchester. In addition to that, we had several medical students who participated in the research with us. Tim Seelaff, who became a hepatobiliary surgeon in Minneapolis. Jeff Young, who I'm sure many of you know, who is the chief of trauma at UVA. Andy Schneider, who is a plastic surgeon in Winston-Salem, and several other students over the course of the years participated. The focus changed from looking at the physiology or pathophysiology of these animals to become more basic science, basic research or cellular oriented over the course of the years I was there, and became incredibly sophisticated thanks to the efforts of our collaboration with Barry Fowler. Harvey would always guide our projects, and insisted that we write our papers, send them to him, and then a couple of days later we get things sent back to us all covered in red ink, and we have to go and do the whole thing again. But we became very prolific and presented at all the usual shock meetings, such as the Eastern Trauma, Western Trauma, Surgical Infection Society, American College of Surgeons, and so on and so forth. So it was an incredibly rewarding experience. Although Harvey left us up to our own devices, he was appropriately tough and fair when it came to being productive. He supported us in every way he could. Many of us became good friends with Harvey's family, with Betsy and the kids, and we babysat the house when they would go on trips and vacations and so on and so forth. So it was a phenomenal time for us. And it was only when I went on the residency program 2.5 years after I arrived in the US to Harvey's lab, that I realized that although I thought he was incredibly prolific from the point of view of his lab, he was even more prolific in terms of his clinical practice. The number of cases he did every year, the amount of clinical papers he wrote regarding bariatric surgery. It was right around the time that he had written about the effects of or the propensity for patients who had VBGs to regain their weight because they became sweets eaters. All that stuff was going on at the same time as he was producing all the stuff from the basic science lab. After the years, I think Harvey's interests changed and he moved on to the ab shell, which I think somebody else is going to talk about. I left the lab and then went on the residency program, and then was appointed as a assistant professor of surgery at the Medical University of South Carolina, where I've been ever since.
Hi, this is Grace Ruzicki. I'd like to express my gratitude to Dr. Schauer for the opportunity to speak to you about my dear friend, Dr. Harvey Sugerman. To the Sugerman family, you've suffered a great loss, and I am truly sorry. My connections with Harvey span a period of about 40 years, and they have 3 separate connections. I'm a professor of surgery at Johns Hopkins University, where Harvey did some training. I also am a past president of Western Trauma Association, as was Dr. Sugerman. And of course, I did some of my medical training at the Medical College of Virginia in Richmond. And that's where I first met Harvey over 40 years ago. I was the intern assigned to the surgical ICU, and the ICU was full of high-risk patients. Harvey had just launched his groundbreaking gastric bypass procedure. Each day, Harvey pounded me with questions that I not only didn't know the answers to, but I didn't even understand the questions. His scientific mind was so far ahead of mine. He demanded the best from all of us for these patients, and we got the message. He set the standard of care so high, that was the standard of care for the patient. What I didn't realize at the time was that Harvey was teaching me a life lesson. And that was, don't be afraid to tackle something that's new. And when you do, study it diligently so that you collect data and the data will prove its worth. I have many fond memories of Harvey related to the Western Trauma Association, the dinners, the mountain picnics. Harvey and I loved our double-decker burgers. We never skied together, though, because Harvey's skills were the double black diamonds, and I could barely make it down the bunny slope. I can still remember when Harvey was publications chairman of the Western Trauma Association. He was so diligent and efficient. If you asked a question, you almost immediately got the manuscript to review. And of course, after getting about 6 manuscripts, I quit asking questions, and that was more than enough for me. I feel very fortunate that our paths crossed, and it was a privilege to know him. Harvey was a person of great character who lived a life filled with service and made contributions that truly mattered. I leave you with a quote from his Western Trauma Association presidential address. We want to leave the world a better place than when we found it. And if we can do this for many, as well as the few, then so much the better. Harvey, you did leave the world a better place for many. Thank you.
Well, thanks everybody for those contributions. They were phenomenal. One of the areas of Harvey's practice that is sort of little known is the fact that he actually had a huge practice in inflammatory bowel disease surgery. He found that that at MCV, where I was a resident and Eric worked, those patients really didn't have any champions. So he had taken on, for example, total colectomies and ilioanals in patients with ulcerative colitis, and he had perfected this technique of J-pouch with a stapled anastomosis, and that was phenomenal. Nobody else would do those cases, because he also felt that he would do those cases without diverting ileostomy, because he published that the morbidity of an ileostomy is about 30%. So again, he published many papers on ilioanal techniques, and also he took care of all the patients with Crohn's disease. One of the funniest things I can remember was Harvey was not a natural laparoscopist, and back in the day, none of us were natural laparoscopists. But when the lap band came in first, MCV was one of the first centers that was picked out to be part of the first trial, and I came up from Charleston to watch Harvey do 2 lap bands one day, and I think I stayed with Eric, and went in the next day to the OR to watch Harvey do 2 lap bands. It took 4 hours per lap band, and I mean, this is a procedure that subsequently we were doing in 20 minutes. But at about 6 o'clock in the evening, we both dragged ourselves out of the operating room and went straight, obviously, to drink 18-year-old scotch, because we were both so frazzled. Great times. Going to hand over now to Phil, I think, right? You're muted, Phil.
Me first.
Oh,
Carl.
sorry, Eric first. Sorry. Go ahead,
Yeah.
Eric.
So it's great stories from the days at VCU, and Carl was with us. And then I have to say how moved I am to see so many people on the chat who have a connection to VCU, who are just remembering Harvey for all the impact he had on their lives and their careers over those years. You know, it's been said now a number of times how Harvey was a champion for patients who needed help. And that's really true. That's part of, I think, why he was so motivated and inspirational when he took on bariatric cases. Harvey almost never turned down a bariatric patient for surgery. No matter the risk or the complexity or the amount of effort that would be required on his part, he would measure up to the challenge, because he really was motivated by helping people. And I think that's one of the more tremendous parts of his character, and why we all had such great respect for him. So to lead into the next section, I'll turn it over to Phil to tell us about the next section.
Yeah, thanks, Eric. And I just can't help but comment on all these wonderful comments on the chat line. Please keep them going, folks. They really stir so many wonderful memories, and they're going to be preserved. So keep those going. And you know, as I listened to all of those videos, I just marveled at all these areas Harvey was able to master. You know, his surgical skills in the laboratory, you know, the bariatric contributions, you know, to the field. And then we didn't even hardly touch upon these other areas: inflammatory bowel disease and ilioanal resections he was well known for, you know. So, and then he was a leader and publisher and all these things. I mean, truly kind of a Renaissance kind of guy. So the next section, I think you're going to really, really love. The next section, you're going to know all the speakers. They, you know, many of them are well known in our field, and they're each going to provide some very personal comments about what Harvey, you know, meant to them. And before we jump into that, just a brief reminder about the opportunity, you know, to support a memory for Harvey. We're not quite sure what it will be yet, but no doubt it will. Whatever contribution you're able to make, it will go and support something that will give back to the society, to the field, because that's the only way Harvey would have it. So stay tuned for this next session. You're gonna love it.
Thank you for this opportunity to pay tribute to Harvey Sugerman. We really lost a great leader. And I would like to tell you about one of his unrecognized contributions. When gastric bypasses were adopted in the 1990s, they were adopted far too quickly. Surgeons saw the diagrams as just another form of gastric surgery. A number of these were done rapidly. There were a lot of obese people, and the results were frankly disastrous. In some hospitals, mortality rates ran as high as 10%. So at a meeting of the ASMBS, it was clear that we needed to address this. So Ken Champion and Alan Whitgrove and I decided that we would try a Centers of Excellence program. In order to do this, we needed also an independent auditor, and so we formed a nonprofit surgical review corporation run so well by Gary Pratt. It took off and it was a success. In a short time, mortality rates improved. Even so, we still had no insurance coverage. So Harvey Sugerman said, until you're going to convince Medicare to cover this operation, you don't have a chance. We thought this was impossible. But there was nothing ever impossible to Harvey. So he kept bugging the Medicare, and he sniffed around and finally found that there was a surgeon, believe it or not, an ophthalmologist, who was one of the staff in the Medicare facility. So through him, he got us an invitation, and so he dragged me down to Medicare to present our case. He did a brilliant job. And at the question was, well, how are you going to prove that they're eligible? He said, oh yes, when the BMI is over 40, or if they're over 35 with comorbidities. And he later admitted on the way home, he just pulled this out of his hat. Nevertheless, it stuck. He convinced Medicare, and in 2006, only 2 years after we started the Centers of Excellence program, he had full coverage by Medicare, and a few months later by the other major carriers. So as we remember this great leader for his personal courage, his innovation, and his science, let's also remember him as a person who had unusual tenacity when he pursued a good aim. We will miss him greatly. Thank you very much.
Hello, Henry Buchwald here, talking about our late colleague, friend, Harvey Sugerman. In losing Harvey, we've lost a giant. We've lost a pioneer. We've lost an exemplar. He had many qualities, one of them was introspection. If you gave him a problem, a patient synopsis, he would think about it deeply, and he would come back with an original answer. And it was worth listening to him. He was intrepid. What do I mean by that? When he believed in something, and it usually was for the good of all of us, he stayed with it. He fought for it. He didn't let adversity stop him. He didn't let personal concerns stop him. He knew what was right, and he was going to do what was right. This was a man of integrity. And if you had to sum up Harvey as a colleague, he was a man of integrity. He was also a man who was loyal and a friend. He was a friend to the discipline. He was a friend to us, his peers. He was absolutely a friend to his patients and to patients elsewhere. And above all, he was in love and happy with his Betsy and his family. Harvey, we will miss you, but we will always quote you. Thank you.
Harvey, who is currently working with Mohit Bhandari in India at Mohawk Bariatric and Robotic Surgery Center. I'm glad to be part of this tribute to Harvey Sugerman, a great scholar, academician, and somebody who's contributed to bariatric surgery and to general surgery as a whole. I met Harvey in 1969 when I was a pharmacy extern in Philadelphia and he was a surgical resident. You all know Harvey was a nerd. He drove us crazy. We were trying to prepare solutions for hyperalimentation. Subsequently, I became a friend of Harvey when we met at the colloquium in Iowa, where he assisted me to write prospective randomized studies in bariatric surgery, which are published on VBG and gastric bypass. In 1990, unfortunately, I nominated George Cowan from the floor, and George became the president instead of Sugerman, who was nominated by the nominating committee. I became a bad hombre to Harvey at that time, but that didn't stop Harvey from reaching back to me. He reached out to me and we worked on a multi-center study on gallbladder disease and the oxalic acid after gastric bypass. That paper was published in 1995. After the debacle in the presidential election, Harvey left the ASBS and only came back a decade later. What was interesting is when Harvey was with us initially, he again was kind of cantankerous about ASBS using or starting an independent journal. He wanted us to join an established journal. George Cowan, Dieter, and I pushed for an independent journal. When Harvey returned, he ultimately became the president of the ASBS, which became the ASMBS, and Harvey became the editor of the outstanding journal of the Society for ASMBS, which is interesting. Harvey appointed me to be the representative of the ASMBS to IFSO. I finally became the president of that society, and Harvey and I have been friends since. I'm glad to be part of this tribute. I wish Bessie and the family well, and I know we're going to miss him. Thank you.
Hi, I'm Georgianne Mallory. I'm the Executive Director of the ASMBS, and Dr. Harvey Sugerman was our 18th president. All of our presidents are brilliant. All of our presidents have very, very strong leadership capabilities. But two other characteristics that I think are important for the president are, one, that they have a deep care and concern for the patients that we serve, and then also that they have a very strong drive to advance the field, advance patient care and access to care. And Harvey had that in spades. And Harvey had an interesting year as president, as all the presidents have pretty interesting years, but we were at risk of losing Medicare coverage for our patients. And Harvey jumped in with both feet, with all his tenacity, left no stone uncovered, and we ultimately prevailed and the patients did not lose their coverage. It was a very fortuitous year to have Dr. Sugerman as our president. And I have a little personal story to tell. It's a Scotch story. I've heard there's a few Dr. Sugerman Scotch stories going around, but this one's mine. And that's that I always bring a bottle of Scotch to the annual conference, and during the dinner dance, I give it to one of the bartenders and they'll serve it to me discreetly when I come up. Well, I don't know if he's got an eagle eye or he just has a nose for it, but I was up at the bar and he was there like a flash and going, hey, they didn't serve me from that bottle. So we continued to have a wee dram, maybe two. And what was really nice is it became a tradition. Every year at the dinner dance, we would have a glass of scotch together and a little conversation. So I always look forward to that. And then on the evening of the dinner dance during his presidency, when it ended, he had people up to his room. And well, had a nice time. And then most everybody had left, and we were sitting around had a pretty dining room table that was in a suite, and Harvey and I were talking together. There were a few people at the end of the table, and then Betsy and someone else were in conversation across from us. We were reminiscing about the year, and all of a sudden he stopped and looked across the table at Betsy and said, "Look at her. Just look at her." I was going, "Yes, thinking what?" And he said, "Isn't she beautiful?" Harvey was tough. He was really, really tough. There was no candy coating anything when it came to Harvey. But he could also be very tender because things mattered to him and people mattered to him. And it's been so nice sharing these stories because all of us that knew Harvey Sugerman are going to really, really miss that very multifaceted man. Thank you.
I'm John Dixon from Melbourne, Australia, and I've known Harvey for more than 20 years. During this time, I've been in full-time research, and my interests have been obesity research with a focus on the impact of living with obesity on health. I've also then really focused on the effect of weight loss in all aspects of the issues related to weight. I found Harvey to have a couple of passions in life. One, Betsy and the family were key to his existence. Secondly, I found that he had this passion for research, always thinking about the mechanisms and so forth. Harvey was sharp, thoughtful and innovative scientist. We would regularly find time at meetings to have a chat and discuss what his thinking was, and to bounce off ideas about his key interests. Of course, his seminal work was that of looking at the impact of intra-abdominal pressure on health. His research was novel, groundbreaking, and results extraordinary. However, my view was that he was ahead of his time. His results predated our current knowledge of cardiometabolic inflammatory factors, gut microbiome, all sorts of things that we now understand. And if you think about it, we could actually see that a modest rise in intra-abdominal pressure in a chronic state could influence all of the factors that we now know contribute to the problems of abdominal obesity. Harvey's results, his early results and so forth, are quite compelling, and I expect that we will need to look further into this. Harvey hypothesized that raised intra-abdominal pressure during pregnancy, that increased intra-abdominal pressure that is a subacute compartment syndrome, could be a contributor to the development of preeclampsia and eclampsia. Just look at his paper in Medical Hypothesis, and you'll get an idea of the mechanisms involved in his thinking, in the process. Simple postural changes could be seen as a way of treating preeclampsia and improving health outcomes. It was very difficult, though, to get studies in this area initiated, despite many years of trying to do that. Only recently, I was reviewing the outcomes of postural change on patients with respiratory problems with COVID-19. It appears that lying prone or face down has a major effect on improving oxygen saturation, in addition to improving survival and health outcomes. Harvey might have suggested that posture may have had an important effect on this, and I think he may have had some ideas as to how to improve this effect. Harvey has shown us the way. He's shown us and introduced us to a very important area of research, but his work is unfinished. We need to understand better the effects of acute, subacute and chronic intra-abdominal compartment syndromes. I would suggest that in his memory, a fund or foundation is put together to actually progress this important work. It is important, and Harvey would really dearly love us to move it forward. Thank you.
I too would like to say some words about Harvey Sugerman. I was not fortunate enough to have trained under him, but like everybody else, I benefited from his life's work. Harvey was the ultimate researcher and educator. He demonstrated that the gastric bypass not only led to weight loss, but improved multiple comorbid conditions. And I often quoted him when he stated once in a meeting that there's no other intervention in all of medicine that could make the claims of the gastric bypass to make so many comorbid conditions better with one intervention. And from Harvey's over 200 publications, we learned a lot about bariatric surgery. Harvey was also an advocate. He fought hard and won against Medicare to get bariatric reimbursement, a gigantic victory for our patients. He was instrumental in creating the Center of Excellence concept, as well as the ASMBS fellowship program. His efforts helped improve the quality of care for bariatric patients worldwide. And he believed that all surgical programs needed to function at a high level of quality, obtained through education, training, data collection, and site visitations. He felt it was no longer acceptable that patients might have surgery by poorly trained surgeons in poorly staffed, resourced, and supportive facilities. Harvey was also a leader. He was president of ASMBS in 2004, and in 2005, he recognized the need for a new journal to be the major publication organ of ASMBS. He helped create the journal that was named SWORD, Surgery for Obesity and Related Disorders. And even up to his untimely death, he was still functioning as the editor-in-chief. His hard work and vision were responsible for the success of SWORD, which has repeatedly ranked highly among the English language surgical journals. Most importantly, Harvey was a special man. By his own actions, he taught us about inner strength. I remember a keynote address he gave where he courageously spoke about his personal struggles with depression. And in addition, after his tragic accident that left him paralyzed, he fought to recover as much strength and mobility that he was able to. And even paralyzed, he continued to work on the journal and to contact colleagues. What I will remember most was the strength he demonstrated at the Obesity Week meeting where he gave the Mason lecture. He gave it from a wheelchair in front of several thousand attendees. One can only imagine how he felt. You could see how physically weak he looked. It took him the use of both hands to advance his slides, and his voice was frail. Yet he found the strength to complete the talk. That strength that he demonstrated on that stage that day should be an inspiration for all of us to not give up and not give in. I, among with everybody else who knew Harvey, will miss him. However, he left us quite a legacy through his work and as an example for the rest of us. Harvey, will miss you terribly, but we won't forget who you were and what you meant to all of us. Thank you.
As I think back on my life and times with Harvey Sugerman, I realize he was a very complex individual. He was many things to many people. But every time I think of Harvey, I think of him as a surgeon, and that's why I'm wearing scrubs to shoot this short video to honor him. Mostly I think of him as the proud individual becoming the president of the ASMBS. I think back on my several years of interactions with Harvey as we were preparing to have the passage of the presidency from my presidency to his. He wanted to work hard for the society and for the members of the society, and not for his own personal glory. Though he was an educator, a father, a husband, an academician, an author, an editor, and many other descriptors, I personally always think of Harvey as that individual who worked hard for the society members and not for his own personal gain.
Good evening. My name is Bruce Shermer. I live in Charlottesville, Virginia, and I want to begin by extending my sincere sympathies to Betsy and the rest of Harvey's family. He was a great surgeon, a great man, and will be missed. I wanted to give you a message this evening to just tell you a little bit about Harvey's collegiality as a fellow Virginian. When I was in my first year on the faculty at UVA, I hadn't really had much training in bariatric surgery, and we were starting a program. So I needed somebody to try to teach me to really do the operation well. It was gastric bypass. I had the brashness to call up Harvey, who lived just 75 miles away, and say, would you allow me to come watch you in the OR? I really would like to learn how to do this well. I said, I realized that, that could pose a competitive threat in terms of me being within, range of some of your patients, and I don't want to offend you. But he just started laughing. He said, are you crazy? He said, there are so many overweight people, we will never be in competition. And he was absolutely right. So I went and watched him. I learned a lot from him. We both had thriving practices for years after that. And that was really great. One other thing that's important to mention is Harvey was instrumental in getting the Virginia legislature to pass a law that said if insurance company had offered a comprehensive plan in Virginia, it had to include coverage for bariatric surgery. This was back in the 1990s. So we were way ahead of most states in terms of insurance coverage due to Harvey. And there really are very, very many Virginians who are now alive, well, and enjoying a much better quality of life because of Harvey Sugerman. Thank you all very much for listening.
Hey guys, this is Dr. Antonio Torres from Madrid, Spain. The first time I met Dr. Harvey Sugerman was many, many years ago at a meeting of the American College of Surgeons. In this meeting, in a very small room, one of our fellows was presenting our first paper about Sadi's procedure. When she finished, Dr. Sugerman stood up and asked her many questions about the liposoluble vitamins in this study. The discussion was very interesting. When we went out of the room, I asked her, Emmy, do you know who was this guy? She said, no, I don't know him. I said to her, he's a very important guy, important surgeon, is Dr. Harvey Sugerman, one of the most relevant person in bariatric and metabolic surgery in all over the world. Since then, I got impressed of all his skill set, his humility, his ethic, and finally his strength in keeping the honesty in all our surgical research regarding bariatric and metabolic surgery. And now finally, during his role as editor-in-chief of our journal, SOAR, was really outstanding. Dear Harvey, rest in peace, descansa en paz.
Hi, this is Phil Schauer. We have lost a giant, Harvey Sugerman. My sincere condolences to his wife, Betsy, his 4 children, and all the surgical community. Harvey indeed was a quintessential surgeon, scientist, educator, and leader. Beyond that, he was a great personal friend, mentor, and family man. I first met Harvey, already a doyen of bariatric surgery, back in the 1990s at Surgical Grand Rounds during my residency at the University of Texas in San Antonio. His lecture on the benefits of bariatric surgery was truly inspiring and planted in me a seed of interest that was destined to sprout in my future. Years later, after finishing fellowship in advanced laparoscopy at Duke, and later joining the faculty at the University of Pittsburgh, I became dazzled by what Alan Whitgrove was doing with laparoscopic gastric bypass. I then plunged into bariatric surgery. I naturally sought guidance from Harvey. When I first invited Harvey to speak at one of our bariatric surgery courses in Pittsburgh, he initially said no, but perhaps this was due to his reluctance in embracing laparoscopy. But he did later send Eric De Maria instead. I think Eric was really sent to test the waters. Eventually, Harvey came around and became a big contributor to our courses. He actually learned the laparoscopic approach, and this was quite a testament for somebody to learn this procedure in their late 60s. Ever since then, Harvey has found a place on my office wall of fame. And here he is. Right here, this is a photograph of Harvey, myself, Saida Kramadin. It's about the year 2000 at one of our Pittsburgh courses. Harvey also became a lifelong mentor to me, as well as many other surgeons. He had all the attributes of a great mentor: very encouraging, critical at times, and frankly inspiring. On the other hand, Harvey never let friendship or admiration get in the way of a stiff reprimand. He used to say, "What's good for the goose is good for the gander." Years ago, after I missed a couple of Sword editorial board review deadlines, he fired me from the board. What nerve he had. He generally, though, let me back on the board, but I do think I hold the record for being most fired by Harvey. Here's another fun fact about Harvey. Harvey, an avid skier, one day said, "Phil, why don't you have a bariatric surgery course at a ski resort?" Hence, MISS, otherwise known as Minimally Invasive Surgery Symposium, was born in the winter of 2001, and for 10 of the last 20 years has been held at a world-class ski venue. It was originally Harvey's idea. Harvey was a regular and dedicated faculty member at MISS, and he also gave great ski lessons. One year, he even came to MISS right after neck surgery and showed up in a neck brace. And here it is to prove it. There he is, Harvey with his ski sweater and his neck brace. What dedication. Harvey would also often acknowledge that much of his success he owed to his lovely wife, Betsy. And here they are, right there. Not only was Betsy Harvey's wife, the mother of his 4 children, his best friend, but she was also his clinical nurse and co-investigator. That's right. Betsy was a co-author on many of Harvey's landmark papers about pseudotumor cerebri, venous stasis disease, and bariatric surgery in the elderly and adolescents. Harvey was always quick to give Betsy credit. As sad as it is to lose Harvey, I must say that to me, this sadness is overshadowed by the gratification I feel for his friendship and his remarkable legacy. Just yesterday, I saw a patient in clinic with pseudotumor cerebri, otherwise known as intracranial hypertension. As I reviewed her record, a spontaneous smile and nod overcame me. I Googled the topic, and up came Harvey's classic paper introducing bariatric surgery as an effective treatment for pseudotumor. As Bruce Wolfe has eloquently summarized, there are so many contributions from Harvey, and we are so grateful. Harvey indeed does belong on the Mount Rushmore of bariatric surgery. What a legacy he has left us, and I'm so grateful to have called him my friend. Thank you.
Hi, I'm Matt Hutter, the president of the ASMBS. Harvey was an amazing man and is a true inspiration for all of us. Harvey exemplifies how a single individual can have such a profound impact on countless patients and on an entire field of medicine through dogged determination, inexhaustible energy, remarkable resiliency, and genuine inquisitiveness. We all should look closely at our field and think critically about what needs to be done to make our surgeries better for our patients and ask, what would Harvey have done? And then do it, no matter how challenging it might be, no matter what seemingly insurmountable obstacles might confront us. That is what Harvey did his whole life. Thank you, Harvey.
So I'll take this intermission here. We're moving now from invited videos to the many spontaneous contributions that we received from people all over the world who just wanted to be present with us tonight to pay tribute to Harvey Sugerman. And with that in mind, I would point out that in the world of academia, you have friends and you sometimes have rivals. And one of the more really amazing things about Dr. Sugerman is that many of his rivals had tremendous respect for him, which is not always the case in our business. So let's go ahead and roll the videos from the folks who felt compelled to contribute to tonight.
Hi, this is George Field in New York, and I'd like to record a tribute to Harvey. I was very saddened by his passing. In the early 2000s, when I was trying to show American surgeons what I thought were the benefits of the lap band, the kindest thing you could say about Harvey was that he was a thorn in my side. But I liked him enormously. He was just straight. He said, "George, this is BS." I said, "Okay, Harvey. I actually don't think it is, but good on you." He just was straight. And it never wavered, and I respected him enormously for it. I'm very sad about his passing. Good on you, Harvey.
Carl, thank you so much. It's a really great privilege to be able to say a few words about Dr. Sugerman, who, quite frankly, did so much for me and influenced my career in so many ways. If you Google Sugerman, the computer screen offers you Superman instead. And this is actually not too far off the mark in some ways. I can't think of anybody I worked with, or indeed whose practice really that I've seen, who was just so diverse. He had such a diverse set of skills with a busy clinical practice in inflammatory bowel disease, trauma, and of course the bariatric surgery practice he's arguably most famous for. But alongside all of this, he had a lab researching adult respiratory stress syndrome and septic acute lung injury. And this is where I met him. I was lucky enough to be one of his research fellows for 2 years. He got me going, and I was lucky enough to present our work at meetings all around the US at prestigious outlets such as the SIS, the SUS, the American College of Surgeons, and so on. And we went on to publish much of this work that we did alongside Barry Fowler. He taught me so much, and this idea of collaborative working with allied experts was just one of the many things I learned from him. I will be eternally grateful for my time in his lab and what I got from it, not least because I'm absolutely confident it was Harvey who got me my clinical fellowship at the Cleveland Clinic with Dr. Fazio and his team, and then allowed me to go on and get the various posts that I've got following that and my consultant's post. So, thank you, Dr. Superman, and thank you, Carl Byrne, for inviting me to say a few words about Harvey. Thank you.
Hi there, Al Windsor here from London, and it's with great sadness that I make this short video. I just had communication from Carl Byrne, and I had not heard from Carl for a long time, and he gave me the news of Harvey's sad passing, and obviously extremely saddened by that news, and felt compelled to at least put something to the Festschrift, or the celebration of Harvey's life that's coming up. I was Research Fellow in Richmond from August 1991 through till October 1993, and had such a wonderful experience that I was very nearly junior resident, or at least resident, in October 1993, and wanted to stay in the US, and Harvey was going to facilitate that for me. It was a huge part of my life that I will remember with extreme fondness in many, many ways. I'd come fresh out of a teaching hospital in London, arrived to the lab in Richmond, really not knowing what to expect, and was just blown away by the friendship, by the hard work, but by the camaraderie and everything else that went with being a research fellow in Harvey's unit at MCV. I remember all the characters there, Chuck Blocker with fondness, Harvey, Barry, all of the guys that too many almost to mention. And I think it was a very important part of my life, both from a work perspective, because it provided me with the most wonderful CV. I published paper after paper, had a wonderful experience in the lab itself, and really understood all of that and really got a great deal out of it. But also more than that, it was a very fraternal place to be in Richmond. Lots of expats, Carl, Kieran, and all their families, etc. We arrived as newlyweds in Richmond and had Jack, our eldest, there. And so, again, very important part of our lives, and central to all of that, right at the heart of all of that, was Harvey Sugerman. I think his enthusiasm and drive in the research side of things, his positive reinforcement, there was something about Harvey that made you just want to work. And I really enormously enjoyed the work, hard though it was at times, in the lab. And then there was second family, Betsy and the kids, Harvey, there were barbecues, there was parties at Harvey's, etc. And it was really very much being part of a Richmond family, along with all the other guys in the lab and around and about. I remember one time when Harvey and the family were away for Christmas, and we had some friends over for Christmas, and Harvey gave us their house to use over the Christmas period. I mean, it was just very much part of that family, and it's with huge fondness that I will remember him, I remember the family, and I remember Richmond, Virginia, which, as I say, was an incredibly important part of my life, my development in medicine, and something I will always remember and always be hugely grateful for. I'm sad to see you go, Harvey. I wish you, Betsy, and the family all love and my condolences and best wishes. Wish I could be with you, and hopefully one day we might be able to catch up again. Thank you very much.
As an educator and mentor, nobody was more passionate about our field than Harvey. Whether you're a medical student, resident, fellow, faculty member, or just had the ability to work with him on a committee, nobody inspired us more with more passion than Harvey in the field of metabolic and bariatric surgery. And those of us who had the privilege of working with him know that although we may have worked with him in some capacity in our careers, we never stopped working for him. Rest in peace, Harvey.
Good evening. I will miss Dr. Sugerman, as we all do. He and I, on many occasions, discussed fishing at the end of the day, both fly fishing and spin casting for saltwater species such as speckled trout, redfish, and the elusive snook, a species of fish that he chased after many years after his retirement to the coastal waters in South Florida. You know, when you got a phone call from Dr. Sugerman, you felt like you'd been called to the principal's office. Many years ago, while chairman of one of the committees, I had a project proposal to submit to ASBS for discussion at their winter retreat. I got a phone call from Dr. Sugerman asking many questions about details of the proposal, what it would entail, cost, personnel involved, etc. You know, he was a no-nonsense person and always wanted all the details before you had that discussion with the rest of the group. Little did I realize that when I made the presentation, he was going to invite me to stay for the rest of the agenda and discuss all the items on the agenda that day, as well as participate in discussions and lead some of the panel discussions regarding issues that were impacting the society. Little did I realize what he had stored for me years later. I will miss Dr. Sugerman, miss his acerbic wit, and the contributions that he's made to the society in trying to improve the delivery of care to all the patients that we take care of.
My name is Declan Carey, and this is my tribute to Harvey Sugerman. My sojourn in Richmond, the Medical College of Virginia, was from summer 1988 to 1990, along with my wife Bernie and our newborn son Fergal. Harvey came into our lives personally, socially, and for me professionally, and has stayed with us over the years since. As a young man building a surgical career and moving to the US, uncertain of what the longer term would bring, I found Harvey and his lovely wife Betsy to be rocks of support. Both opened up not only the delights of Richmond to us, but also the Blue Ridge, DC and the Carolinas. In the lab, under Harvey's watchful eye, I grew to become expert in research techniques and methodology, skills which I would draw on time and time again. Learned much from Harvey about collaboration, note the collaboration with Barry Fowler and colleagues. For a brief period, I was the world's leading expert in extravascular lung water in the porcine model of sepsis. Other words capture those packed 2 years. Superoxide and long-lived oxygen radicals, H2 antagonists, ibuprofen, and anti-TNF alpha antibodies. The US Army grant, site inspections, and Basil Pruitt, the inspector. Harvey was a guiding light, a mentor, and in later years was steadfast with strong recommendations for future jobs in Imperial College London and the Chinese University of Hong Kong. I had the opportunity to present our work at all the major US surgical meetings over a 2-year period, culminating in 2 papers in successive years at the Surgical Forum. To finish, there's an Irish language expression when someone close or well known to you dies. Yesh J. Goriv Anam Delish. May his loyal soul rest at God's right hand. Thank you for this opportunity.
Dr. Sugerman was a mentor to me mostly. I spent 7 years in training with him at MCV, and from my very first day when he showed me how to take out an appendix, which in 1996 was with an incision, to picking a lab, to learning how to do an open gastric bypass, to taking care of ICU patients, to standing up in front of him in M&M and having to discuss a complication. To which of you have never experienced Dr. Sugerman at your weekly M&M? It was eye-opening. Every step along the way, he had my back. He was a supporter of me as a physician and a woman in the world of surgery in a hospital where there wasn't too many of us. He always said to me, Colleen, you do a great job, but you can do better. heard that line when I wrote my first paper for him, Colleen, do better. I heard that line when I was standing up to do my first solo gastric bypass. You can do better. You're doing a great job. I'm proud of you. Do better. At the end of residency, I wanted to stay at MCV, and he looked at me and said, you have learned the Virginia way. Go to Florida, learn from Dr. Rosenthal, and then you will do better. I will miss Dr. Sugerman not only for his wise words, but for the knowing that there was always this man that had my back, that had my respect, and had my love.
Hi everyone, it's Marina Curry, and I wanted to post a tribute to Harvey Sugerman. I had multiple occasions where I would interact with Harvey. I always found him to be kind and just and really thoughtful. And he was someone I went to with a complicated patient. I remember talking to him about cirrhotics and whether we should be operating on them or not. And he absolutely felt like those were tough cases, but those were cases that were worthwhile doing. And I think that helped kind of formulate how I went forward in my practice. Harvey didn't train me, he trained lots of great surgeons. And he has also been an extreme example of everything that we should be doing in bariatrics. He really took us to the point where our data is just so superlative compared to other disciplines in surgery, and took SWORD to the high level that it is now as one of the top surgical journals. So he is definitely going to be missed, and my condolences to Betsy and the family.
Hi, I'm Dr. Corey McBride, and I am a professor of surgery at the University of Nebraska Medical Center in Omaha, Nebraska. And I had the amazing pleasure of being trained by Dr. Sugerman at Virginia Commonwealth University, formerly Medical College of Virginia, as his second minimally invasive and bariatric fellow from 2001 to 2002. Dr. Sugerman was an amazing mentor and surgeon, and I consider myself incredibly fortunate to have learned minimally invasive and bariatric surgery from him. I was fortunate enough to learn open bariatric surgery from another past president of ASMBS, Dr. Boyd Terry. And so when I wanted to learn minimally invasive bariatric surgery, Dr. Terry arranged and helped me get a fellowship from Dr. Sugerman and Dr. De Maria at MCV. And it was really one of the best years of my life. Dr. Sugerman was an amazing mentor because he really taught with science. He believed that our specialty needed to be rooted in science and not anecdotes. I'm sure many other speakers will talk about the importance of many of the prospective randomized trials that he did. And they always amazed me. He could quote the literature like almost no one that I've ever worked with before or since. Not only the literature that he added to our specialty, but the literature of other people, and it always amazed me. And the literature that he added to our body continues to be relevant today. Studies that he did 15, 20, 25 years ago are still being quoted in very important articles and held up as important pieces of literature. I'm also critical care boarded, and I keep that board certification up. And I think that's important. And when I got to VCU, I realized I found a kindred spirit in Dr. Sugerman as well. Most of us who will be watching this tribute know of all of the contributions he made to bariatric surgery, but many of you don't realize that he is also an amazing trauma surgeon and really loved trauma and critical care. He's a past president of the Western Trauma Society and had a real love for caring for trauma and critically ill patients as well. And so in my year at MCV, VCU, we also spent many hours talking about care of the critical care patient, the trauma patient, and that bridge of how do we take care of our critically ill patients with obesity. Because honestly, this is an area where there's a lot of gaps to this day in the literature. You know, how are our larger patients, our patients of size, not maybe so successfully taken care of in the ICU? How is it different for our patients of size in the ICU? And this was an area he found fascinating, and that we talked about a lot. I will never forget my year at in my fellowship and everything I learned in that year from Dr. Sugerman. Many of the things that he said during that year, I still find myself quoting, and I say it to the people I train. I still, you know, when it gets to a hairy point in the case, I find myself saying, nobody move, nobody gets hurt, which reminds us all to, you know, stop, take a breath, don't make any hasty movements, and think about what we're about to do. And I'm sure everybody else who's been trained by Dr. Sugerman can quote many of the other great things he said to remind us of the care we need to take as we're taking care of patients. I will miss him. I've cried a lot of tears in the last few weeks for him. And I look forward to participating in the conference to celebrate him. And I'm sure I'll have a lot more tears as I hear everyone else's stories. Thank you for joining us tonight, and I'll see you then.
Richard L. Evans said the following: do your work, meet life as it is, know that each service is essential, and never be bored. I think this typifies the life of Harvey Sugerman. Dr. Sugerman, when he and Betsy began to visit Park City, Utah, because their daughter had moved there, I was blessed with their coming into my life a little more than seeing him at annual meetings. Harvey and Betsy would come and visit with me at our research facility. Harvey to share ideas and Betsy to support Harvey's interest in research activities. He was willing to help our group get some additional funding that has lasted us for a number of years, and we've pursued some very interesting topics that Harvey had a passion for. Following his accident, much of Harvey's therapy was in the Salt Lake City area, and so Harvey and Betsy again would reach out to me, and I actually saw very little reduction in his enthusiasm to pursue research and to help assist people. Most importantly, I got to know a little bit about Betsy and Harvey's love for their children and their demonstrated devotion to one another. It was so impressive. I'll always be grateful for the example Harvey and Betsy have shared with me. In closing, someone once said the secret of life is constancy of purpose, and I believe Harvey demonstrated this both pre and post accident, constancy of purpose. And I'm grateful for his example and the tribute that I could give to him today. Thank you.
There are, of course, many stories and many incidents with Harvey, but one that is dear to my heart is when he came up to me at one of Phil's MISS meetings. I think it was in Salt Lake City. And he asked me if I would like to join him for dinner. I said, yes, of course. I was flattered. And frankly, I thought I was going to join a large group of other admirers of Harvey. And so I was surprised when I arrived at the restaurant that it was a table for two. It was just me and him. And we discussed all aspects. He was very interested in my personal background and in my views about surgery, its future challenges and future promises. And I was just so flattered that he was keenly interested in my views. I was a lot younger then and much less experienced. Shows what a considerate man he is, or he was. As for lessons learned, you have to advocate for your patients. And by example, he was a strong advocate for his patients, whether it was quality outcomes, initiating the centers of excellence. And I watched him, stand up in Medicare to advocate for his patients, stand up in FDA at the FDA and his viewpoints on the FDA trial for the gastric band, again advocating for his patients. So he had many good qualities that we all adopted and learned from. Thank you, Harvey.
Years of friendship have taught me that Harvey Sugerman was a man of consequence and a world-class advocate for the validity of science. His passionate leadership and contributions to the advancement of the surgical care of severe metabolically deranged obesity have been legendary. I've long admired his masterful organization of expert surgeons and authorities who presented vigorous scientific data at the March 1991 NIH Consensus Development Conference on GI surgery for obesity. The conclusions and sentiment published in the statement of this conference were precedent-setting. They emphasize the important value of investigations for innovations that might mitigate the epidemic of unhealthy obesity, and they supported a positive medical and societal culture for the care of the severely obese. Then, in early 2020, Harvey testified before the FDA that the available scientific evidence was insufficient to approve adjustable gastric banding as a standard of care procedure. I will always remember Harvey as an inspiring husband, father, grandfather, surgeon, teacher, researcher, writer, and leader. This is my tribute to a very courageous and caring man. Thank you very much.
Harvey, you were an amazing teacher, friend, mentor, and colleague. My best years in practice as an attending were the first few years with you. Everything you taught me about bariatric surgery, I still teach to my residents, students, fellows, and patients. I'm still quoting you on post-gastric bypass diet. I always say nothing beats the potato chip, and you taught me that well. I'm sorry the last few years were filled with me apologizing for the Ravens beating your lovely Steelers, but at least we agreed the Patriots suck. I have so much to say, but I'm just gonna leave it like this. I love you and I miss you.
Add my voice to the chorus of praise for a pioneer in our field, Harvey Sugerman. We wouldn't be here without him. He made so many discoveries, and more importantly, he launched our accreditation movement and patient safety initiatives that are bearing fruit now, where we see bariatric surgery never be more safe or effective. He was a friend and a colleague to me. He was a mentor. He was someone that ran a tight ship, but I was proud to be part of it. And if you want to hear more about what my feelings are about Harvey, read the editorial I had for him in Bariatric Times. You can kind of see over here. So again, Harvey, you will be missed. We won't see your like again. And appreciate everything you've done for the society and for myself. Rest in peace, my friend.
Basically, that's phenomenal stuff. Thank you, everybody, for contributing. But at the end of the day, Harvey was an incredible family man, and you've heard from some of the Irish fellows and Al, who came over from London with basically nothing except the small baggage that they carried with them. And Harvey and Betsy embraced all of us tremendously during those years. Kate and I, my wife Kate and I, were the first Irish fellows that arrived over. Harvey picked us up in Richmond and put us up for a night in a hotel, and we thought, all our dreams had come true. And then we went and I worked in the lab, and life went on. But about 2 years later, after things had sort of settled down, I was still working in the lab, and my wife Kate had become Harvey's clinic nurse, and that was my key to success, because he felt that he couldn't do without her, so he made sure that I went on the residency program at MCV so he could keep her for another few years, which was fantastic. But during those years, we sort of became intimate with the Sugerman family: Andy, Catherine, Elizabeth, and David. And when Harvey and Betsy would go away, we would be entrusted with the care of the Sugerman kids while they went to meetings and so on. And they were all sort of teenagers at the time, or younger than teenagers. And it was great fun. Harvey had a fabulous house out in Moorland. We all would hang out there with the dog, take the dog for walks, wash Andy's filthy soccer gear when he came home from practice, do all the laundry. There was washing machines going day and night in the place. It was fantastic. But I always appreciated Harvey as a father, and as years have gone by, I realized what it is to be a father. So much so that when Kate got pregnant in our final year in residency, we asked Harvey to be my older son's godfather, which he agreed to do, and that was phenomenal. And just fast forward 30 years, my older son is getting married in 2 weeks, and there would have been nothing better for us than to have Harvey and Betsy come to his wedding, but unfortunately that's not going to happen. I'm sure many of you who were on the original memorial for Harvey after he passed, which was probably maybe a month ago or so, and Andy Sugerman, Harvey's oldest son, ran the entire program, and it was incredibly heartbreaking and phenomenal. So we asked Andy to send a short video from the family, and this is coming up next. Thank you.
Hi, my name is Andy Sugerman, and I am Harvey's oldest son. On behalf of my family, I want to thank you all from the bottom of my heart for taking the time today to remember my dad. A great husband, friend, mentor, colleague, and at times a pain in the ass, but always with the best of intentions. Carl asked me to say a few words to you all today, so here I am. 2020 has been quite the year. Certainly a year that none of us are going to forget anytime soon. For me, saying goodbye to Harvey back in August was honestly one of the most difficult things in my life, both then and now, and I imagine for some time to come. Over the past 2 months, I've had a torrent of memories with my dad that have been just rushing through my head. From our annual ski trips out west to our summers in Hilton Head, watching tennis, I believe Wimbledon, out on our outdoor porch in Richmond, to sitting down at Christmas dinner. Even now, as I sit here and speak to you all, I struggle with the idea that I can't simply pick up the phone and give him a call where he can bemoan how ineffective our government is or how poorly the Steelers played the prior weekend. Although I will say he'd be over the moon to know that the Steelers are already 3-0 for this season. My dad had an unrelenting pursuit. A pursuit of what, you might ask? Honestly, the pursuit of everything and anything. He was never satisfied with the status quo. There were always new things to learn, new procedures to master or invent, new mountains to conquer, new rivers to explore. He could never sit still, and he expected the same from everybody that surrounded him, as I'm sure many of you know all too well. But I have no doubt that it was this drive that not only made him a success in his field, but had the same impact on all of his children, myself included, and hopefully all of you as well. His same drive and pursuit lives on in each of us as we tackle new challenges and make our way through this crazy topsy-turvy world. We're all emboldened by channeling my dad in whatever it is that we're doing, to push further, to climb higher, to run faster, and at the end of the day, sit back and enjoy a nice 18-year-old scotch on the rocks. I truly miss him, but I do find some solace in knowing that he's at peace. And every time that I conquer a mountain, I explore a river, learn something new, or just enjoy a nice glass of scotch, or in my case, bourbon, I'll always think of my dad and your friend, Harvey. On behalf of my entire family, thank you all once again for being a part of my dad's journey.
Well, folks, we've heard some just incredible commentary from luminaries in the field, from friends, from colleagues, and now the Sugerman family. And Andy Sugerman did just a phenomenal job. I mean, he's kind of a chip off the old block, isn't he? Yeah. So we do want to thank the Sugerman family for that incredible tribute and the photo collage. But, you know, as Carl and Eric and I and the whole organizing team tried to figure out, I mean, how do you close out properly this tribute? And I think we all kind of unanimously felt, well, let's give Harvey the last word. Let's let him close it out. So this next piece, and we're almost done, and we thank you for staying with us. This next piece is Harvey in his own words. Listen.
My life as a bariatric surgeon was exciting. I worked hard, enjoyed every minute. There were a lot of ups and downs, but the ups far outweighed the downs. After I retired, Betsy and I moved to Sanibel, Florida to begin a new life. It was a great place with new friends and interests. Everything seemed perfect until one day on May 31st, 2 years ago, I decided to hang a bird feeder from our kitchen window and fell. My life changed in a split second, not only for me, but for Betsy and the children. So begins the last and most challenging part of my journey. I was airlifted to the ICU in Fort Myers, where I spent 10 days, then Learjet to Shepherd Rehabilitation Center in Atlanta for 3 months. While there, I developed severe urinary tract infections, the first one with septic shock, and another stay in the ICU for 10 days. After a couple more UTIs and a couple of attacks of C. diff colitis, I was reminded that the solution to pollution is dilution, and drank more. I was able finally to begin rehabilitation. I had a C6 injury and a burst fracture at T5. Slowly, I learned to move my arms and hands, although my hands are still quite weak. I could not move my legs. I was able to resume work on Sword, which was a lifesaver, and I'm very grateful to Bruce Wolf for helping me out those 2 months of my true disability. This is one of my grandchildren while I was at Shepherd, and my lovely wife. After Shepherd, we moved to Utah, where one of our children lives. We started therapy at the University of Utah and then found a place called NeuroWorks and had a wonderful physical therapist. Betsy drove me 35 miles each way up and down the mountain 3 days a week. We found a psychologist who was very helpful to both of us. We stayed in Utah almost a year and then moved back to Sanibel this past October. I was nervous about coming back for rehab because we were leaving state-of-the-art facilities. Amazingly enough, Betsy found a physical therapist who we'll see soon, Ray, who I've been working with for almost a year. He is the first person after 2 years who started to work with my legs. And most importantly, they're beginning to move, and he gave me hope. I have learned that life is precious and never be taken granted. Be aware of how fragile our lives are. During these 2 years, I've experienced so many different emotions: anger, guilt, depression, and hopelessness, and more. I've learned that suffering is everywhere. Like Betsy says, if you think you have problems, just look around. I've learned that it's not how many papers you write or how many kudos you get or what titles you have, but what makes your life worthwhile are the people who love you and who you love. I've learned the true meaning of friendship and what those friends mean to me. Someone sent me a card every week. I also received hundreds of cards from others, and surprise, not one of them were alike. Walter Porys sent me a watercolor kit, And this is an example after a long time of my first watercolor. Bob Brolin has called me every week, and Phil Shower checks in periodically. Move it forward, please. I've learned that no matter what life throws your way, you have a choice. You can either accept it or do nothing, or you can change your situation and work for a change. I've decided to do the second, and believe me, it has been much harder than working every other night in a trauma surgery and all the other times spent doing surgery and taking care of my patients. I learned what it's like to be a patient, the fear and uncertainty of not being sure what's going to happen and what will be the result. Be thankful for the little baby steps of progress. Set goals, but realize that things don't always go that way. We want. But that doesn't mean to forget these goals. They just might take a little longer to achieve. As a surgeon, I always wanted to see a quick result, but I have learned that sometimes we have to wait, and what we wish for may take a little longer than we want. Finally, I've come to understand what tough love really means. Catherine, our daughter, says Mom's like a dog with a bone. She's been on me from the beginning and doesn't seem to let up. She has made me angry and very frustrated at times, mainly because I am not used to having someone else, especially my wife, tell me what to do. But I now realize that without her, I would either be dead or lying in some nursing home. She has taught me what the true meaning of love is, and for that, I am really grateful. She has taught me that she will never give up on me, so how could I ever give up on myself? To summarize some of the lessons I learned through my career, and we're missing one slide, don't let mental illness get you down. Be supportive of others when they are down or have a substance abuse problem. Don't believe everything a professor tells you. Beware of authoritative articles, even those in very prestigious journals. Don't take rejection for a concept or manuscript you believe in without fighting back. Be open to new ideas and concepts. Don't jump into a new idea or procedure without an adequate education or training. Conduct clinical research and publish your results, like here, both good and bad, so that it can be a benefit to patients around the world. And finally, don't fall out of a window or off a ladder. My sincere thanks are owed to my colleagues, you in the audience and the ASMBS, but especially our leader, Georgianne Mallory, and the Executive Council for supporting me as Editor-in-Chief of SWORD for the past 14 years. And last but not least, my wonderful, beautiful, supportive wife, Betsy. It was primarily her work that we have 4 very productive, successful adult children and 9 terrific grandchildren. Thank you for listening, and thank you for your friendship over the years. Life is a journey, and now, as a late friend of ours said, every day I see the sunrise, that's a good day. Thank you.
Harvey, we miss you.
Well, thank all of you for hanging out with us for the last few hours. It's been incredible. What incredible memories that we share of this great man. We owe him so much. And on behalf of Eric De Maria and Carl Byrne and the entire organizing committee and ASMBS, thank all of you. We'll be posting this tribute on the ASMBS website in the near future. Thank you again. God bless. to Harvey.